May 17th, 2021 Services Committee meeting. I'd entertain a motion to approve the agenda by Mr. Sheridan, seconded by Mr. Fay. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Entertain a motion to approve the minutes of the April 19th Services Committee meeting.
So moved.
By Mr. Denisha, seconded by
Second.
Mr. Smithers. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. We'll start with public health. Jolene, I don't know if you've got any report preceding these resolutions, or is it just the resolutions?
Just the resolutions today.
Okay, so the first resolution is authorizing the chair to sign a contract with Jack Vineski CPA and Associates for preparation of the preschool school supportive health services annual Medicaid cost report for the Public Health Department for the July 1st, 2021 to June 30th, 2022 program year. Is there a motion by Mr. Akers? Is there a second?
Second.
By Mr. Sheridan. Jolene?
So this resolution, the dollar amount for it, the $4,500 yearly, remains the same from last year, and it will allow Jack Vineski, CPA and Associates, to file our annual preschool report on our behalf.
Any discussion or any questions? Seeing none, all in favor?
Aye.
Opposed? Carried. The second resolution is authorizing the chair to sign a service agreement between the Public Health Department and Stericycle for disposal of medical waste. Is there a motion by Mr. Akers, second by Mr. Smithers and Ms. Haggard? Any discussion? Jolene, you want to address this?
So this resolution is actually just to renew our contract with Stericycle, and it actually reduces our monthly cost by $57 a month. Stericycle removes our medical waste that is generated by doing immunizations, medications, and benefactors to humans, along with our rabies vaccinations to animals.
Any questions or any comments? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is authorizing the chair to sign the Emergency Preparedness Program contract for the Public Health Department. Is there a motion? Mr. Smithers, seconded by Ms. Fiacco. Any discussion? Jolene, you want to comment on this?
So this is for our Public Health Emergency Preparedness Program HRI contract for the July 2021 through June 30th, 2022 year. It is an increase in the contract from last year of $828, and it's for the Emergency Preparedness Program, which we use to promote and protect the health of county residents for health emergencies.
Thank you. Any questions or any comments? Seeing none, all in favor?
Aye.
Opposed? Carried. Thank you very much, Jolene. Have a great evening.
Thank you.
Okay. Next, Community Services, Mr. Ulrich is with us. The first resolution we have is authorizing the chair to sign a contract with Coordinated Care Services Incorporated for preparation of the 2020 Consolidated Fiscal Report and modifying the 2021 budget for community services. Is there a motion?
So moved.
By Mr. Sheridan, seconded by Ms. Curran and Mr. Smithers. Go ahead, Jay. I think you're muted, Jay. We got a problem? Dylan?
Is he on? Or is
He's
it-
there, and it looks like,
Hang on a minute, Jay, we're trying to see if it's on our end.
Jake, can you hear us? Can you nod?
Yes.
It's on his end, I'm gonna have to give him a call.
Bear with us, Dylan is trying to get this straightened out.
Oh. And I can speak to this if you'd like, and then Jay can wave his arms if I make too many missteps in explaining this, if you'd like, while he gets connected, and he can add to it if you
Sure.
prefer. So this resolution provides the opportunity to bring in coordinated care services with the recent departure of staff in the fiscal unit to be able to complete this task, working on timelines set by the state. The county is very interested in getting this completed. And so providing this opportunity would allow them not only to be late, but in keeping with the proper year to be completed for the CFR, which is a report that's required, but also to assist and make sure the providers in the county continue to receive their funds. Jay has, in this last week, had some real successful interviews. He expects to onboard an administrative services manager, the potential to have a fiscal officer starting shortly, but all of these folks starting would also need to get up to speed on how to complete this report. So these folks are versed, they perform this for other counties, and they're quite capable of performing this function for us. The expectation is that this would happen this year only, with staff on board for next year. If there were an interest to do that again, it would come back before the board. Jay, did that sound okay? Got the nod.
All right. Any issues with us voting on this now, Jay, or would you want to hold off until we see whether or not you are going to
Can you dial in by
audio
phone?
hooked up?
Doing a different place right now.
Okay.
I have a question.
Okay.
I'll take this.
Of the county administrator?
Yeah, I mean,
Yeah, go
so
ahead.
it's $10,000, $10,540. It seems very specific. Was that based on the size of our community services group, or how'd that number come up?
My understanding is they were given, I believe, 18 and 19 reports to take a look at, and they're familiar with the work that goes into it. So I think they were able to estimate the hours necessary to complete the one for 2020.
Okay, thank you.
You should have audio now.
Jay, did you hear that explanation?
Say that again, I'm sorry.
That's okay. The question was asked about how the $10,540 number was arrived at. And my answer
Yeah.
was that a couple of years of CFRs were provided to them to take a look at the work that goes into it to prepare for 20. Was there anything you wanted to add to that?
Nope, that's correct. They reviewed previous CFRs, and we've got 13 different programs. Really, they're funding codes, for both mental health and addiction services.
Okay. Anybody else have any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is authorizing the chair to sign a new membership agreement with Northwinds Integrated Health Network IPA Incorporated. Is there a motion by Mr. Sheridan, seconded by Mr. Perkins? Jay?
Okay, so yes, this is a new contract. The last contract was executed in 2019, and it had some old language in that contract, so they updated it. They took out, some of the citizen advocates language that was the lead agency at the time. So just by way of explanation, for review, this is a independent practice association It's made up of behavioral health network providers. And it's kind of what is a tier type of organization. So they are tier 1 members, and there's currently 5 tier 1 members, and there's 7 tier 2 members. A tier 1 member can enter into a risk-bearing agreement with either Medicaid managed care organizations or accountable care organizations. A tier 2 provider cannot enter into a risk-bearing agreement. Now, we had the opportunity last year to enter into a risk-bearing agreement because the IPA, Northwinds, held the risk rather than to pool the risk amongst the providers. And they are doing that again this year, that same arrangement where Northwinds will actually hold the risk rather than have the providers hold the risk. So again, the main goal is to enter into a risk-bearing, value-based payment arrangement with a managed care organization. For the first year of the contract, the possible upside shared savings that could go to Northwinds is $21,600. That's if we meet all the indicators that they set. When I say indicators, it's things like make sure that people have a 7-day and a 30-day follow-up visit after they leave an inpatient unit. It could be decrease the number of avoidable emergency room encounters. It could be depression screening. It could be controlling hypertension. There's different quality indicators that Adirondack ACO has laid out for the network providers. So the downside risk of last year's contract was a possible loss of $131,000 for Northwinds IPA. So we really won't know what this shared savings is going to be until October, when all the data is compiled. So right now they are in a level 2 contract, and they're wanting to renew that contract this year as well.
Any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. Jay, next on the list is a clinical update.
Okay. So the update is pretty flat compared to last month. It might have gone down a little in terms of the weighted face-to-face visits, but it's pretty flat. What's most remarkable is the no-show rate jumped 1.8%. So, in trying to make an explanation for that, I know on the addictions treatment side, with the clinicians being back, they're doing more toxicology testing. And because of that, they tend to no-show more because, if they're using and then they get tested, then, they try to avoid that. So that's part of it. I think the weather and, just springtime. So we've had an increase in no-shows, but in spite of that, we're still pretty flat in our production. It didn't go down that much. We do have 25 people on the mental health waiting list. We are down one clinician, and we have one clinician out because of COVID-related concerns. We are hiring another mental health counselor. We actually offered her the job today. She'll be starting in, I believe it's 2 to 3 weeks. So that will hopefully clear up that wait list. The wait list is triaged. They're given the option of either staying on our wait list or being referred to another provider. And these 25 that are currently on the wait list are just asking to remain on our wait list until we have availability. In terms of the service provision, it went down a little bit from 2042 in January. It's 1962 for February. Don't really have an explanation other than could have been weather related. But the individual served remained flat. So are there any questions?
Mr. Akers?
Nothing on this report, Jay. The last time that we spoke with you, we talked about the opioid clinic and that you were going to talk with St. Lawrence Health Systems and give us an update. Could you do that for us, please?
Okay. Well,
Mr.
I
Chair,
have.
they're next on the agenda.
Yeah, they're gonna be.
All right.
Yep.
Go ahead, Jay.
Are we ready to move into the COSUP grant?
Yes, we are.
Oh, wait, John might have a question.
Mr. Burke? Wait a minute, Jay. Mr. Burke, go ahead.
Jay, how important is it to your operation to have the ability for remote working?
Well, we are still doing remote working, but the clinicians are no longer working at home. But predominantly, I mean, that's still the preferred method of providing services as per the regulatory agency because of the pandemic. But now that we have clinicians back in the office, like I've mentioned before, the conflict has to do with, you know, if they're quarantined, if their children are quarantined, you know, if they have elderly people in their home and choose not, you know, to come to the office, then we lose their ability to see clients on certain days.
Thank you.
Thank you. Anybody else? Jay, we're ready to move into the COSAP grant
Okay.
update.
All right. So I have Dr. Jamie Smith here from St. Lawrence Health Systems. But before I turn it over to her, I just want to kind of give an update on our side. We have hired the fiscal manager. She started April 19th. She has access to all but one of the 4 portals, and we're working on that to trying to get her access to the portals. We have been doing some performance reporting, financial reporting. Of course, it's been flat. We haven't drawn down any funds off the original $900,000 award, but we will be doing that this quarter, particularly because of the fiscal officer's salary expenses. So we are moving forward. The contracts for the sub-awardees, you know, I've been working with Mr. Button on that, and those are en route to the Board of Legislators' office for the chair to sign. So any questions on the community service side of the grant project?
Make sure Sean's here.
No questions, Jay.
Okay. So I'd like to introduce Dr. Jamie Smith from Canton Potsdam Hospital or St. Lawrence Health Systems to give her update for the grant work.
Hi, good evening. Can you hear me okay?
Yes.
Yes.
Okay, so if it would be possible to share my screen, I'd like to just do a quick presentation.
Please go ahead.
Okay, I'm going to try to do this. Okay, is that working? Can you see?
Yes.
Okay. All right. Thank you for bearing with me. So I'm just going to give you a brief update since last time Jay was able to talk about our progress. We had completed the pre-1A consult. And at this point, all of our schematic level drawings have been completed. We have been able to surmise the construction costs. Those estimates have been completed. We did hire our construction manager, and we have chosen Pike to do that. At this point, we're really just working with the Shapiro Group on the lease. The lease is kind of the most important next step. Of course, the Shapiro Group are the owners of the St. Lawrence Center. So once we have that ironed out, we'll be able to move on that. I did want to share with you the schematic drawing. So what you're actually looking at are two distinct clinics. Our plan is to open up an Article 28 psychiatric clinic next door to the OTP. We really think this will be wonderful for the community. The psychiatrist will be able to operate out of both clinics. So patients who may need mental health treatment can do so literally quite next door. This will also be helpful. We're hopeful for the folks at the VA clinic, should they need mental health services, they can walk literally right across the hall to obtain that. We did play around with the concept of the OTP several times because we really wanted to make sure that patients had ease of access. We really want people to just be able to come in the morning, get their medication, leave quickly, and get on with their day. So if we're familiar with the St. Lawrence Mall across from the VA clinic, actually where the bouncy houses are currently, this is that space. This is the outside entrance, so the back entrance of the mall. The patient will walk in. They have an option at that point to either turn left and go into the psych clinic if that's where they're headed that day, or to go right into the OTP. I don't know if you can see my mouse. I hope you can. At this point, they can check into reception and really just go right across this roundabout, pick up their medication here, and head out. We do have exam rooms, group rooms, office space. Therapists will be located here. The MD, the NP, they will all be located here. So when the patient does need to do their group or their individual therapy or see their provider, they can utilize the space back here. But for the most part, for that daily dosing, we just wanted to create a way for the patient to be able to quickly come in, go through reception, get their medications, and leave. So really trying to be thoughtful of our patients' time. This is a more complicated drawing of what I just showed you. I didn't know if anyone was a little bit interested. It's also flipped upside down because that's how competent I am at PowerPoint and Adobe. So I apologize. But this was the OTP, the reception, the dispensing area. Back here are the office spaces, restrooms, break rooms. Also, these are just visuals. We know what the clinic is going to look like. We are working with our partners at Sedgwick. This is an example of what our exam room will look like, our waiting room, dispensing areas. This is the aesthetic. I just wanted to include that so that you can see. Also, we have our contract with Methasoft. Methasoft is the EMR, the electronic medical record that we will be using. Methasoft is really a fantastic product. We're really excited that we were able to work with this company and find them. So their electronic medical record obviously contains patient records, but not only that, it interfaces with this contraption here called Methaspense. This is actually how the methadone is dispensed, and it's all done electronically through the medical record. So it significantly reduces human error. That we can pull up the patient via fingerprint, and it'll automatically know what the dose is for that patient, dispense right into the cup, and the patient can be on their way. It'll also be able to hold our therapy notes. It will hold, just general medical data that we need. So we're really excited about this product. And the contract is ready and awaited to be signed. Our next steps is to have the lease completed by June 1st. And at that point, we do need to submit a CON. Because we are a hospital-based program, all of our new projects do need to go through DOH. So we'll be submitting that CON. The process at that point is that we'll get contingent approval. They will ask for a more detailed review. We will give them said review, and then we'll be able to move forward. The Oasis application, again, it's completed. It's awaiting the lease. Once we have the lease, we can submit that. As you may know, there are several layers of approval. We are working closely, obviously, with Jay and with our field office representatives, Allie McPherson. They know that we're doing this. Oasis is aware. So everyone's prepped and ready. It's just a matter of the paperwork. Alongside this application, we have the DEA and SAMHSA applications processed. Those things cannot be submitted until we get Oasis approval, but they certainly can be prepared and ready to go. So that's the state of affairs. Are there any questions? I should stop sharing my screen.
Okay. Mr. Burke.
That diagram looks very familiar. Has there been much change in the diagram since you applied, since your application for the grant?
Yeah, it has changed quite a bit. We really wanted to nail down the workable space. Previously, we had patients sort of walking down around corridors through the office spaces to receive medication. Spent a lot of time working with folks to really design a space that's accessible and easy for patients to get in and out. We really want to make this as easy as possible for patients.
And if I could, since this was an OTP grant, are you keeping separate budgets for the mental health versus the substance abuse?
Oh, absolutely. It would be completely inappropriate to merge any of those budgets. Those are completely separate. That's, one of the good things about having such a great working relationship with Jay is that he's able to see what our budgets look like and what we're doing. So yeah, anything that comes out of the grant is distinctly for the OTP, and there's plenty of costs, so we can use it up.
And just one final question, if I might.
Go ahead.
Why is it taking so long?
Yeah, no, I appreciate that question. I think, unfortunately, COVID has slowed everything down. It's been really difficult to move on lots of different projects, not just this one. We were heartened to hear from the federal grant that we're actually on schedule with the other projects. Jay was able to ascertain that information. Everyone's sort of moving at a slower pace because of COVID, unfortunately. We have pretty firm deadlines with the other agencies that we're working with because we want this to move. And so June 1st is our target date to get those applications out the door. And we're hopeful that things will move fairly quickly after that.
Anyone else? Ms. Hager.
Oh, thank you, Mr. Chairman. Doctor, thank you for your update. I have two questions. Number one, John asked, I think we were all kind of hoping that this was going to be a little more timely, so to speak. That's a statement. My second question is, are you moving staff out of Potsdam and other areas to put into that mental health clinic, or is that something brand new?
No, so that will be brand new. The OTP clinic, the portion of that clinic, as we had initially asked, that definitely will be staff from Potsdam that will be moving. We may end up hiring some additional staff, but no, the other clinic that's not part of this project will not have any staff moving from Potsdam.
So if you had to, I won't hold you to this, but speculate, I mean, is this going to be done in 6 months? Is it going to be done in 8 months? I mean, I've been on the board since COVID started, and this was something I was involved with, so I've kind of watched this whole thing, and it seemed like it was going to be further along at this point. Can you give us an idea when it's going to be done?
Yeah, we are hopeful for the end of the year. We share your frustrations. I was hopeful that this was something third quarter we would be ready to open. So this has been, this has been very disappointing for all of us. I can assure you we're doing everything that we can to try to get this going as quickly as we can, but I am hopeful for the end of the year.
And Mr. Chairman, if I may, one last.
Yes, you may. Go ahead.
Thank you. Will you please keep us updated and give us some goalposts along the way as you make progress? Because I know everybody wants this to be open.
I agree. Yep, absolutely. Definitely will do that.
Thank you very much.
Thank you.
Anybody else? Jay, anything further from you? Any comments on the doctor's presentation?
No, I did, like I said, or like Jamie said, I did speak to the COSAP grant manager who's down in Washington, D.C. Big projects like this do take a while to get off the ground. And she said it's not unusual for this 3-year grant period to actually be extended into the 4th year. So.
Okay. If there is anyone else, Mr. Akers.
Dr. Smith, what length of time of the lease are you looking at for your investment, return on your investment?
Yeah, we're looking at 5 years. I think that's one of the points that they're trying to nail down.
Okay, thank you.
Anyone else? Well, seeing none, excuse me, Dr. Smith and Jay, thank you very much. Appreciate your time.
Yep, thank you.
All right, moving along, the next resolution is authorizing the chair to sign a lease agreement with Lot Number 21 Incorporated for space for the Department of Social Services in the city of Ogdensburg, New York, located at 206 Ford Street, and modifying the 2021 budget for the Department of Social Services. Moved by Mr. Denisha, seconded by Mr. Reagan and Ms. Curran. Any discussion? We'll move to Cynthia.
Good evening. So this resolution is in regards to the space in Ogdensburg and renting that space. And what we're looking at doing there is having one of our CPS units and one of our hopefully preventative units be out in that space. This is part of we're kind of calling it a pilot program, so to speak, as we're looking at trying to integrate our staff more into the community, being more involved, with the clients that they are working with there, being more accessible. So, and hopefully at some point, potentially working with the school districts to see what support we can do with them as well. So this property, renting this property in Ogdensburg will provide us that opportunity to start this type of project. Another piece of this is going to be some potential drops as well. We might be able to have an office or two there that we can have some drops for staff that are, coming in and out of the area where they can stop and do work, they can stop and do some printing and different things like that instead of traveling back and forth to Canton when it's not necessary.
Any questions? Mr. Reagan.
Cynthia, how many staff do you expect will be operating out of this space?
I'm thinking probably 14 to 15. And that's not including our drops, so that we can have open for staff that, like I said, will be hopefully mobile moving through the area.
Thank you.
Welcome.
Anyone else? Seeing none, all in favor?
Aye.
Any opposed? Carried. The next resolution is authorizing the chair to sign a contract between the Department of Social Services and the Mental Health Clinic of Community Services to provide the services of a qualified individual under the Family First Prevention Services Act. Is there a motion to move this? By Mr. Sheridan. Is there a second?
A second.
By Mr. Denisha and Mr. Arquette and Mr. Perkins. Cynthia?
So this resolution, in regards to the qualified individual, the QI, is part of the Family First mandates. So this will provide us the approved staff that we need for any of the children that we have in care that will be entering any type of congregate care setting as of October 1st. So with that requirement, there's an assessment that's required by this qualified individual to help determine whether that child will be eligible for that level of support or not. So in our ability to contract with community services through Jay, there hopefully will be a few staff there that will be able to send in an application to be approved for this type, providing this type of assessment, which would create, it will enable us to, get these assessments in a timely manner. We won't have to be on a waiting list. There are time constraints to have this done. It's got to be done within the first 30 days a child goes into care. So we're hoping that starting off with this resolution to start a contract is the first step in moving forward to having staff easily accessible to create these or to complete these type of assessments.
Mr. Berg, go ahead.
Cindy, would you mind saying one more time what the purpose of the assessment's for?
So the qualified individual person at this status is the only type of staff that is approved through OCFS to complete an assessment on any child that will be entering into congregate care. So this qualified individual will perform an assessment, and then we'll determine if that child is at that level to receive that type of intensive care. Or they might determine that this child, it doesn't really require this type of care. At this level, maybe we can look at, either a lower level, less restrictive environment, and so forth. In order for a person to qualify for congregate care, this assessment has to be completed, and this is the only way that we will be able to receive our Title IV-E funding for that child, if they are in congregate care.
So the assessment, Cindy, is for congregate care. Are those like group homes? Is that what congregate?
Yes, it's a qualified residential treatment programs.
Right. It's not for regular placement and foster care.
No.
No.
So hopefully there won't be that many, but just there's waiting lines to get staff at this level to do these assessments. So we're going to want to be able to get that assessment done as soon as possible.
How many children in care do we have, Cindy?
Right now we have 335, and at this time we're down to 16. We have 16 children that are in the institutional type settings.
Thank you.
You're welcome.
Anyone else? I have a question, Cynthia. How many of those children that are currently in care are with a relative or a family member?
So right now we have, out of the 335 children, we have 122 children that are in kinship, and that equates to 36% of our children, which is a good number, because right now, as of October 1st, Family First is requiring to have at least 30%. So we are already at 36%.
Thank you. Anyone else? Seeing none, all those in favor of the resolution?
Aye.
Aye.
Opposed? Carried. There is a place here for Family First discussion. Cynthia, I assume you're going to lead that.
Absolutely. I kind of already talked a little bit about it, but I just had some updates. I thought it would be encouraging to pass on that out of our current 335 children, according to the Family First mandates, the requirement is to have less than 12% of those children in congregate care, institutional care, in our qualified residential treatment programs. Right now, we are at 4.7%. So we are doing fabulous with that. And as I just noted, that out of our 335 children, the mandate for Family First will be 30% or more. So right now we are at 36%. So our goal per Family First in 2023 is to keep our children in congregate care down below the 12%, but to increase our children in kinship to closer to 90%. So I think that we are well on our way, you know, and very thankful for the kinship positions that we've been approved for. That's going to help dramatically increase the children that we have, you know, looking for those kinship relationships. I also wanted to note that we've been having our weekly OCFS mandatory meetings every Friday. We've had OCFS reviewing our cases with our CPS preventive staff. That's been going extremely well. We're actually at the point where they're going to basically turn the table, and instead of them providing the review of our cases, our staff are going to be providing the review of their own cases. OCFS will be, you know, listening and monitoring, and the plan is that we will then kind of fall into a best practice where OCFS will pull out and we'll be able to just continue those weekly meetings, reviewing the cases with just our staff and their supervisors. So we're going to continue that as a best practice moving forward. I think it has provided some great training to our staff as they review cases. And I do believe that as we turn around with our next OCFS audit, that it will be, you know, under a better percentage of positive remarks. The only other thing I want to mention too is, and Ruth might speak to this as well, but we've been doing a lot of work on the data that we would like to start presenting to the board. It will kind of come in the fashion of what Jay presents with graphs and different things like that. So we're going to start off with some of the data that we've already been collecting. We've enhanced that a little bit more. So we're going to start off with that, but we're really looking for feedback. Hopefully, you know, after a little bit of time and some trial and error, it will kind of fall into what it is that, you know, everybody here is looking for, kind of represent the department in a way that is easy to understand and does present the information, you know, in a I guess an easier way to understand it. So we've been doing a lot, but I do think that we are moving forward and we have seen a lot of progress here. A lot of work yet with all of our new staff, but we're super excited, and the morale seems to be well because we can, you know, certainly see the light on at the end of the tunnel. So we really appreciate everything that you guys have done for us.
Thank you. Cynthia, you jumped right ahead to the next discussion item, monthly statistics. I think you covered it, at least to my satisfaction. Mr. Akers has a question.
Sure.
Thank you, Cynthia. Cynthia, that's a pretty lofty goal, moving from 35% to 90. I mean, that's puts us up around 280 with Ken, and that's a lofty goal, and I hope you make it. You didn't mention anything about, is there any strategy we have in place of actually reducing the number of kids that are institutionalized? Those kids, that's very expensive per day. I mean, could you tell us what the cost is? Does it vary? Probably does because of their needs, but do you have a strategy of what you can do to reduce that number?
Well, what we're looking at, and I actually have been in a meeting all day with another commissioner and executive director of New York State Child Welfare, and the conversation revolved a lot around the children in congregate care. It's very expensive. The state is pretty much, I would say, can say tired of paying for it. You know, they've got a a sign that they put out that basically says, it's a thumbs down for congregate care, thumbs up for kinship. So what we're looking at is any child, and I think that it's going to help with the assessment, having that qualified individual participate in that assessment, and also have, the philosophy is to have a team around that child that may potentially need that level of care, and to have the family involved, the QI involved, the caseworker involved, the schools involved, any person that, really has a lot of, either influence or guidance or has spent a lot of time with this child, participate in those meetings so it can be a more well-rounded decision as to what, this child may need, what the potential is for, a different type of kinship with more supports, for the school with more supports, and things like that. So, we're really trying to assess these children. Our numbers, as much as they're still high, our numbers haven't grown. They've either stayed consistent or have, fluctuated and decreased in that. So I think what we're doing is making a difference. I think getting more staff in here so that we can, push the preventive care, I think, a little sooner and be more involved is also going to help. Trying to be a little more proactive where we have only been able to be reactive is also going to help. But there's a lot of people on board with this. So not only here, but, there's a lot of talk out there amongst other commissioners. My plan is to do a lot more networking on, keeping up with what's working for other counties, making sure that, we're looking at, every opportunity that we can to support these children to remain out of that level of care, unless they need it for their safety.
Anyone else? Ms. Hager?
Oh, thank you. Ms. Ackerman, we have 335 kids in care, and I heard what you just said, that the staff you've added helped grow. Are we still pretty much ranking at the bottom of counties in the state as far as kids in care, report timeliness, those kind of things, or has the staff impacted that significantly yet?
Well, at this time, we're still ranking low. We did just get the list. There was about 20 caseworkers that passed the exam. So we were able to, we've sent the letters out. We're going to start interviewing. So we're hoping to be onboarding quite a few staff. So it is going to take time for us to make sure they get through the training, provide the training. We're really picking apart our training so it's more specialized, more hands-on. We're going to be doing more mentoring, more involvement with them so that we can, make sure that they're learning what they need to learn, that the trainings are working, and that they're moving forward in their training so that when it comes to where we can start giving them caseloads, we know that they're ready. They've had the mentoring. We're going to be doing, a lot of discussions with them on making sure that they feel ready. Would they like more training in certain areas? Really kind of using this as kind of a, I don't want to say pilot, but a way to move forward so that we can make sure that we're also affecting retention of our staff. In doing that by really valuing them and, like I said, supporting them with what they're going to need to be successful. So it is going to be probably it could be 8 months before we start seeing really a lot of differences, only because it takes that time to put these staff through that intensive training.
And if I may, Mr. Chairman.
Yes, go ahead.
Thank you. Are there any other needs that the board can address that would help this situation? Because we are still sort of at the bottom of the barrel as far as counties go. It's not a great place to be. What else do you need that the board can support?
Well, I think, and like tonight, we have a few more positions going through. We're going to try to balance things out on both sides. So I think that's good. Getting this QI moving forward, that's going to be huge for Family First. And I think that there has been some discussion of, potentially having some of our retirees or people that are retiring maybe come back and help do some training with some of the staff that are either taking over their positions or that they might be able to help with, for a short time frame, at least to pass on the knowledge that they have. So I think with that and kind of getting through this onboarding of the new staff, we're going to have a chance then to kind of reevaluate to see where we are. But I think in looking at everything, once we can get through this training phase, I think that we're going to be in pretty good shape. So the numbers are encouraging.
Thank you.
Welcome.
Anyone else that hasn't spoken? Mr. Burke, go ahead.
Cindy, on one of the metrics that the state monitors, and that's, I believe it's our response to the hotline calls, and that, could you just go over what time they give us? What's the acceptable turnaround time for responding to the hotline calls? What's involved, and maybe where we stand with that, just so we all have an understanding of how significant this is to child safety?
Sure, and good question. And that was actually another topic that we talked about today. So there's the 24 hours that we have to respond to the call. And usually in that 24 hours, we have staff that go out to a face-to-face, check the safety, check to see if the children can either remain in the home or not. And then within a 7-day period, we have to complete a safety assessment and have it into the Connections program. So, but in that 7 days of a safety assessment, there's a lot of work to be done. There's a lot of paperwork involved. There's a lot of documenting involved. You've got staff that are trying to, not only are they sure that they make sure that the child's safe within 24 hours. It's the process of getting the assessment done, getting all the other stuff done, getting your documentation done, and getting that into the Connections. That takes time. So, we've done a lot. We've talked about this a lot because the actual safety stuff is getting completed. But it's like it's always said, if it's not documented, it never happened. So what we're working on now is making sure that we have something in place to trigger, those reminders of what we need to get done and make sure it's getting in time. And I think that as we have created our little team, so to speak, within our unit, each little team having a supervisor, that supervisor is going to be held to the expectation to make sure that they're looking at everything, approving everything to make sure that this information is getting into the system, in a timely manner so that these numbers will then go up.
Thank you, Cindy.
You're welcome.
Thank you, Cindy. I'm glad you're there.
Thank you, John.
Anyone else? Seeing none, I think you've covered it, Cindy. Thank you very much for the presentation. And I know that I, for one, am looking forward to seeing this Family First preventive services get up and running officially. So, and it sounds like you're doing a yeoman's job in the preparation of that becoming law that we will have to follow. And what I'm encouraged about is the oversight that is provided along with the requirements of what has to be done and the numbers that the state has said that they would like to see as a result of this program. I think that with what this board has done, giving you the staff that you need, giving you the support staff that you need, that I think we all hope that you hit the ground running on October 1st. And this is an outstanding success. So I'm sure we all look forward to that. So thank you very much for your part in this.
Sure thing. Thank you.
You're welcome. Mr. Akers, do you want to
Certainly.
read this?
Mr. Chairman, I offer a resolution authorizing the release of funds set aside for the 2021 Bassmaster Elite Series in Waddington, New York. I move this resolution.
Seconded by Mr. Sheridan. And Mr. Denisha, And Ms. Curran and Mr. Arquette. Any discussion? Mr. Akers.
This has been a great success of putting St. Lawrence County on the map. The St. Lawrence River is now known as the #1 bass fishery. Unfortunately, we weren't able to have it last year, and it looks like this year, it looks like full bore ahead. And I think by releasing these funds now, we'll show the communities that we're supporting this series of fisheries and the bass fishing in St. Lawrence County.
Thank you. Mr. Smithers.
Whether it be appropriate here or under old business, I'd like to further the discussion that Legislator Forsythe mentioned last week about the river levels and the website that Kevin forwarded to us. Do you want to discuss that now or?
No, we won't discuss that now. We'll deal with the resolution that is on the table or on the floor right now. And then if you want to discuss that under old business.
I would just say now then that I would think it'd be in our interest to try to make this a positive experience for the people coming to this tournament.
And I think that that has exactly what has happened in years past with them coming. It's definitely been positive. We've got the proof in the pudding on that.
From talking with people that have been on the St. Lawrence, they've been quite discouraged this year and unhappy with the river levels.
Okay. Well, you can bring it up under old business, okay? Ms. Curran.
Yes, I was wondering if I could be offered as added as a co-sponsor to this bill resolution.
So noted. Anyone else? Mr. Reagan.
Mr. Chair, I would just like to urge the business community of St. Lawrence County to show their support for this tournament. This past year, the committee of volunteers that was running it was hard pressed because of the pandemic. We've stepped forward with a substantial amount of money and to send the message that the event will happen this year, but we still need the business community and citizens who are in support of our efforts to build a tourism economy in St. Lawrence County to step forward and help make this a reality. The committee that is working on this needs volunteers, it needs help from the community to make this a successful event. It just doesn't happen on its own. I commend the members of the board for stepping forward and sending the message out there that St. Lawrence County is committed to making this event a reality and keeping our designation as the #1 bass fishing area in North America and basically the world. But we have to do this together. We need the help of the people of St. Lawrence County to make this happen.
Thank you, Mr. Reagan. Anyone else? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is a resolution commemorating the bicentennial of the town of Morristown. Is there a motion to move this? By Mr. Smithers, seconded by Mr. Sheridan. Any discussion? I'd just like to say that this is the 200th anniversary of the town of Morristown being brought into existence, primarily as a farming community in the southwestern part of St. Lawrence County. There have been a number of things that have gone on in Morristown over the years that probably most of us don't know anything about. I can tell you that there used to be a ferry service between Morristown and Brockville, Ontario. I can tell you that Dr. Morse's Indian root pills were born in Morristown and manufactured and distributed in Morristown. Used to be known for the sturgeon fishing in the waters between Morristown and Rockville. Currently, we are looking to remove a bridge and reopen the Morristown Bay area, which is sort of a happy birthday present for the town of Morristown. The village, as you know, has been eliminated by a vote of the electorate, and it's now governed. The village is now a hamlet. It is now a part of the town of Morristown. So what we will be doing with this resolution is providing an appropriate I don't want to say, because I don't know exactly how it's going to be presented yet, but I'm assuming a framed resolution suitable for display in the offices of the town of Morristown. And I would also say that the county administrator has suggested to me, and I certainly agree, that we ought to be doing the very same thing for other towns, other villages that are celebrating similar events in their history. So I would ask that if any of you with the towns that you represent see something like this coming forward in your town, or something deserving of recognition, public recognition, to please let the county administrator know. Is there anybody else that wants to comment? Seeing none, all in favor?
Aye.
Opposed? Carried. We'll go to the Vacancy Committee.
Yes. On this Vacancy Review Committee update, you have two departments that are going to be presenting tonight. Social Services is first with 8, and the Youth Bureau has 1 vacancy in your packet, but it will be, or expected to be, up to as many as 4 or 5 in the intern role. But I'll have Alexa speak to that at her when that comes up. First up is Social Services. Cindy?
Hello. So first I want to say that out of these 8 positions, only 3 of them are new. 5 of them are backfills. So I will start with the backfills. So the first one is our grade B supervisor for Adult Protective Services. This position I'm bringing forth, we are having a very, very long-term staff retire. So we are looking to backfill his position. He oversees our Adult Protective Services unit, very involved in the homeless and our Code Blue, very involved in our hotels, has built great relationships in the community. So he is one of the staff that we are hopeful will be able to, return on an as needed basis to provide training once a candidate for his position is chosen. So that's the first one.
Okay, and Cindy, this was the position we were talking about when we referenced the potential of retirees assisting us in the future, correct?
Correct.
Okay, so you may see or hear a little bit more from DSS on that topic. Go ahead.
Okay, so the next position, this is our grade B supervisor in Child Protective Services. This is being vacated due to a promotion. This staff has moved to our grade A position in Child Protective Services. So we are looking to backfill her position as a supervisor over one of our teams in Child Protective Services.
Questions on that one? Okay, next. Oh, wait. I think Mr. Forsythe has a question, Mr. Chair.
I'm sorry, I couldn't see him. Go ahead, Dave. I'm sorry, Mr. Sheridan's blocking my view of you.
Yeah. Yeah, it's my question's not necessarily on this one, but on the last one. You talked of bringing back retirees and help with training and transitioning. What about reimbursement? Do we lose the reimbursement benefit once they do that? Or is there a program where they could fall under some sort of reimbursement?
I'll answer that. Cindy, I think that's something we could look into. I think it would, if we were either, I think, to contract for services of training, like you've seen us just do with the sheriff's office for a retiree, if you remember, at operations, for a period of time. We could find out from the reimbursement standpoint for the agency reimbursing if they would be able to claim that amount. So we'll get back to you on that if that's okay, Dave.
Yeah, that's fine. It'd just be nice if it's eligible for reimbursement. So, okay.
Well, and good question, because I'm hoping that if it works out, we can, utilize that as a program down the road as well. So the next position was our grade B for CPS. As I was saying, that this staff was promoted to our grade A. Our grade A is now our director of services. So we are looking to backfill her position as a grade B supervisor. Our teams are really coming together well, having a supervisor, over 5 or 6 or 7 case managers.
Questions on that one? And I think I would just mention, as you see some of these, like you've heard in these two, as folks move around into either new positions, dedicated positions to either foster care or kinship, that has to come with some experience. And so that will free up these other positions to bring in additional staff. So when you look at the overall 17 that have been approved so far, some of those as the grade A supervisor are a result of promotions, and others will be the new positions coming in off the street, getting trained brand new. So I just kind of want to make that subtle difference between how those positions are being filled. And probably helpful, Cindy, when we go through those, just to mention that.
Okay, yep, sure thing.
So next one for caseworker.
Okay, so the next one is a preventive caseworker in children's services, and this was a resignation. So this position's been vacated since March 27. So we are looking to get this position backfilled as soon as possible.
Questions on that one?
Mr. Burke.
Cindy, what is our current turnover rate?
I don't exactly know what it is as of today, but I can find that out. I know it's been averaging about 12 to 14%. But this person is going back to school. So I definitely wanted to leave the door open to return in the future if needed.
Thank you.
So that's good.
Any questions? Okay, next one.
Okay, so this next one is a caseworker from CPS. And this is another person, like Ruth was discussing, that is going from a caseworker position to a grade B. So where the B is going to an A, this person is backfilling that B position. So we are looking at filling this caseworker position as Ruth said, we kind of switching everybody around who's interested, and then we will come in and backfill on the end, probably mostly just the caseworkers.
Any questions on this one? Okay. And then the fifth one, Cindy, on the clerk.
So the fifth one here is a clerk. This actually was vacated from children's service. This actually is a kind of an odd position. So this person was a clerk in child support, and was promoted and is now working in our accounting department. So what we've looked at, I did a look back on, where all of our clerks, all of our keyboards, all of our secretary ones, account clerks, where everybody was within the building, under what units. And so we found that we were short in children's services. So we opted, instead of backfilling this position in child support, we are moving it, and we're going to backfill it under children's services to even that out. and give them more support.
Any questions? I think this is very similar to sometimes what we see with abolish and create. But this actually, I'm hopeful with the vacancy is going to give Cindy quicker utility of a person coming in the clerk role. So I think that that's a good purpose in that unit it's coming from, not necessarily needed. It's exactly what we want to see departments talking to us about. Next one, Cindy, the new one.
Okay, so the next three are new. So this one is, we're asking for a grade B supervisor for children's services. And what we're doing is we've spread the whole foster care, child protective services, preventive care out, and we're creating these little teams. So we're trying to, try to keep it to a limit of, 5 or 6 or 7 caseworkers under one supervisor. So what this is going to do, this grade B supervisor is going to even it out. It's going to be able, we're going to be able to combine 2 rather large teams into another team and put that, we're asking for a supervisor to go over that team. This is going to help allow with, for example, I think like the safety assessments and things like that, that John was talking about, and making sure that there's a supervisor that can support these staff, spend time with these staff, and make sure that their, work's getting approved and reviewed and everything that it needs for the connections. So this will help.
Questions on this one? Okay, next.
Okay, so the next one, so this is the second of 2 senior caseworkers that we have asked for. And this CPS senior caseworker will actually be the other trainee. We have one that we are processing for children's services under preventive foster care. This one will be under CPS specific. And these 2 senior caseworkers are going to be working with our new staff. They're going to be training our new staff, taking our new staff into the field, kind of giving them a more realistic approach as to what the position entails and what they need to learn. So we're hoping that these senior caseworkers kind of follow these staff through their whole training process, and then, and then as attrition happens or as people, we're not retaining people, we can have these staff also train new people as they're coming in and follow them through. It's also another go-to person for the staff if they are lacking in a specific area of training, that they can go and work with this person and kind of beef that part up so that we can constantly make sure that our staff are receiving the best training and ongoing training that they need in these positions.
Questions on the senior caseworker? Okay, last one, Cindy.
Okay, then the last one, we're asking for one more keyboard specialist, and this will be in children's services. So this is as well as going to even out the playing field, so to speak. It's going to balance everybody out. The teams are all going to be set, and I think it's going to be nice. CPS does not have the keyboards with each team, but they have secretary ones. On the children's services side, they have the keyboards with each unit, which they have so much more paperwork to process. So this kind of helps each team consistently work through all the paperwork that they need to work through, and supports the staff so they can be doing other things for the children and families.
Questions on this one? Okay, thank you, Cindy.
Thank you.
And next we have Alexa Backus here with the Youth Bureau. Hi, Alexa.
Hi, good evening. With this vacancy authorization, this will allow the Youth Bureau to hire approximately 4 to 5 youth interns this summer for a period of about 6 to 7 weeks to help us in various projects, such as kind of revamping, redeveloping our county school tours, helping with our monthly newsletters, social media, as well as looking at some peer-to-peer mentor programs for area schools. And this would be at no county cost.
Questions for Alexa? So most of you may recall the youth conservation crew workers for years that would be brought on, and COVID changed all of that. But even before our former Youth Bureau Director, Joanne Sevick, retired, she identified some gaps and some challenges that the department would be facing in years to come. And I think this is a great year as we rebuild from COVID, as we look at opportunities with all of the issues facing our youth, to have this group help Alexa determine what that looks like. So I think we're very encouraged about the opportunity, and what may come of it, certainly she'll bring back to your attention.
Thanks.
Mr. Reagan has a question.
The Youth Conservation Corps program, is that going to continue to exist, or has it ended, or what?
It's not going to continue to exist as you would know it. We will not be hiring a summer youth conservation corps to go out into the county to do some trail cleanup and so forth. However, we are looking at some possibilities or opportunities later on this fall. Potentially look at some volunteer opportunities and so forth.
Now, in past years, Ruth, how many young people were employed in the Youth Conservation Corps?
So it would vary annually depending on funding. So you often didn't see it in your annual budget. And as funding became available, whether it came through a trust of some sort, which we have the Dorothy McNeil that provided funding, or we were able to secure funding through grant or other opportunities, we were able to fund crews of 3 or 4 with a youth supervisor of sorts. So they would lead and they would take them to any of the requested projects. We also, I think, ran into somewhat of a shortfall, which COVID probably changed that as well, but we also weren't getting the same level of requests for assistance on these types of projects. So the interest that was expressed prior to Joanne's retirement was, could we look at providing services to seniors? Could we connect in some way to have handiwork projects of like means provided to folks in need? And I think that's really where the interest was going. But it would depend annually. We would probably end up with between 3 and 4 crews. I can remember at least one year where we had 5 crews and some years where we had 1 or 2. So you'd go anywhere from 8 folks to probably over 20, depending on the year.
So
I think the last crew was in 2019. It was 1 crew and less than 7 members. And last year, due to COVID restrictions and so forth, we did not, we couldn't offer it. But I had 1 inquiry the whole summer asking about the YCC program. So, we definitely saw some decreasing numbers over the past few years.
So the long-term intent is to not bring back the Youth Conservation Corps?
No, what we would like to do, as Ruth had mentioned, is to look at some volunteer opportunities, perhaps work closely with Office for the Aging so as to offer some volunteer opportunities for area youth to help people in need.
And I don't think we would make any long-term assumptions. I think 4 years this was tapering off. I think there may just need to be, what Alexa's spending most of the last year doing was assembling the youth program folks across the county and really trying to get that information pulled together of what the needs are. And she has a needs assessment out right now. I think if we have conversations and there's a request for it or a need for looking at the conservation crews, I'm certain that's something she's happy to look at.
Because I
Absolutely.
I feel that the Youth Conservation Corps program was a very unique program that St. Lawrence County took a great deal of pride in and provided a lot of young people from across the county with an opportunity to get out into nature and provide some very valuable services in communities across the county. And I'm just concerned about the, who's, as far as I can tell, those services will no longer be available to the not-for-profits and others that look to the county for those services. And I know, when I went out to some of the work sites and spent some time with some of the young people and the leadership who had been involved for several years, they took a great deal of pride in being involved in that program. And I would just think that before we end such a long and important program to this county, that there'd be a more of a discussion among the board as to what our expectations are from the Youth Bureau.
Anyone else? All set?
All set. Anything else on the vacancies at this time? Okay.
County Administrator's report?
Yes, a few short items about COVID this evening. You may have seen the broadcast today that announced New York State will authorize and fall in with the CDC's recommendation on changes to mask wearing for those individuals who are vaccinated as of Wednesday. So they did, though, provide some exceptions to that guidance. And that includes, at least at this point, and not included on the broadcast, schools, healthcare, nursing homes, public transit, homeless shelters, and congregate environments like correctional facilities. So it brings, and my colleagues have been talking a great deal today about what that means for county facilities. Obviously, we have a mix, depending on the size and scope of county functions, a variety of these types of things. So we're talking about certainly what the courts will be looking at doing. In many cases, some counties are taking the approach that the assumption will be if folks choose not to mask that they are vaccinated, rather than the concern raised about vaccine cards that could be falsified. The Excelsior Pass is available, but again, hard to verify. So the idea being, if you haven't been vaccinated, you'll continue to follow the state's guidance and wear a mask. But if you have been vaccinated, that you are able after Wednesday not to wear masks. So also indicated today was that county fairs across the state got the go-ahead with local Department of Health issued permits of those that would exceed a 5,000 capacity, much like we've talked about in the past with the fishing tournaments. But also they're going to be able to open to capacity to include the 6 feet of social distancing. So some movement, I think, to give folks who are trying to plan some guidance. We've been talking with the fair. Legislator Smithers has been facilitating the work that the county fair is attempting to put together to make sure that we're both ready and able to amend should anything occur where the numbers go back up, or be able to continue forward to provide the experience for St. Lawrence County this August. Also, another indication, I think, of where the state is at this point, the control room phone calls have ended as of Friday. That was the 7-county region. At some points, gathering for the last year, at some points every day or multiple times a day, down to 3 times a week, down to 1 time a week. For the last 3 months or so, only meeting once a week. And now will be available certainly if there's anything remarkable or of note that needs to be shared in the region. It was a great opportunity for the 7-county region to talk on a regular basis, to become familiar with the practices between counties, particularly in response to COVID, and where it made sense to move forward in a similar fashion. So we know the county lines don't necessarily encourage folks to do one thing on this side of the line and one thing on the other. It was a great opportunity for us to move in concert as a region. And in many areas, for a lot of the COVID response, the counties in the North Country region led the number of vaccines being provided, led the number of tests being given. So we have a lot to be proud of as a region in the work that was accomplished throughout the COVID response. But we all hoped, as we parted ways on Friday, not to have the opportunity to speak in that manner with regard to a pandemic response in the near future. So that was a good opportunity to have access to the state, to get questions answered. And our hope is that we don't need to convene in the near future. But I can report since April 21st, when you'll all recall is the date, we brought staff 100% back on site. There have been 3 cases, which we have been able to mitigate those quarantined by results of vaccination. Some have been able to continue working. We've been able to clean the spaces. The county has acquired some of its own equipment when appropriate to use and clean spaces so that folks can return to work in a more timely fashion. Also looking, the One Stop Career Center, as you're familiar, has a number of partners, federal, state, and local partners, who not all have returned to in-person services. And so that makes providing services at the One Stop Career Center a bit challenging. They're looking at the potential for taking appointments only and encouraging staff to communicate as much by phone, email as possible, but that's one of the considerations being given today. As well as the DMVs open today around the county. The clerk has provided the opportunity to come in and receive services. So that is the update with St. Lawrence County. The rate today is 51.2% vaccinated, at least 1 dose. And we're lagging, again, just a little bit behind the state, who reported today 58.7% of vaccination. This week we have clinics, the first dose clinics of Johnson & Johnson at Messina Mall. On Saturday, there'll be a clinic focused on adolescents and family. As you know, Pfizer's been approved. There's a consent form available on our website, and both of these clinics can be signed up through the county website. So check there for updated information. So we're still working to push vaccine out into the community as much as possible. Certainly with the mask initiative moving to not masking once completely vaccinated, certainly, hopefully some initiative. Any questions on COVID at this time?
Yes.
Mr. Reagan and then Mr. Smithers.
Are there any plans to, between now and the end of the school year, to have clinics at each of the schools with permission slips sent home to the parents and the opportunity for, the family to come in and get vaccinated before the school's session ends, so that come September, we have a better chance of returning more to normal?
So with regard to the schools, Jolene is working now to set up some clinics. We certainly would like to funnel as many students as we can through the St. Lawrence University clinic on Saturday, the 22nd. But a survey was sent out to all schools in St. Lawrence County, and it gleaned that there are approximately 1,344 students across the county who would be interested. There are, I believe, at least 4 or 5 school districts who've indicated an interest in busing students to a nearby school or district. And in that case, there would be a consent form available that parents could sign off, but also could present so that they're present with their student to get the vaccination. So that schedule, I believe a survey or a conversation with the superintendents continued today to get more information. And the challenge we face going into, in our large county of 17, or if you count Harrisville, 18 school districts, is making sure we can staff them accordingly. The schools have been interested in providing some staff to assist us, but it ends up being a resource challenge for us. Our efforts will be to get there, to make sure that every school that would like to have a clinic can, but that also needs to occur, as Jolene reported to me, June 3rd, in order to get that second vaccination prior to school's dismissal for the summer. So we'll provide you with updates as school dates in your districts are provided so that you're aware when those clinics will be going on.
Thank you.
Yep.
In regards to your statement about the county fairs and the guidelines, the 6-foot distancing, there's a question about if you have a family that would be able to sit together at a restaurant or in a church, say 5 or 6 or 8. Would that apply to seating in a grandstand at the fair? So that it could, if that was possible, then we could certainly have a larger capacity there. And if we could get some clarification on that.
Be happy to. I was going to say, they didn't speak in specific terms today. They just indicated that 6-foot distance, but in all environments, a family unit has been able to travel and be seated together. So we'll see if we can find that for you and share that out with everyone.
Mr. Akers.
Well, just speaking to that, I don't know why the 6-foot rule was around. Dr. Walensky there, basically when she was at Harvard, had mentioned that for children in school, it would be 3 feet. So I don't know why the 6-foot thing is still kicking around. There's actually no research, empirical research done on any distance as far as transmission. You mentioned, Ruth, that there's 1,300 students that were interested in the 18 school districts. How many kids are there in the 18 school districts that would be age 12 and up?
I would have to get that for you. I know the entire population, so that probably wouldn't be very helpful. It's over 16,000, but this was in response to the survey, so we could find the total
So
to
if
give you a
there's
portion.
16,000, then roughly, I would say probably half would be 12 and up. And so it's only about, for the 18 school districts, it's only about 70 kids per school district. So, you know, I think parents are making those decisions about whether or not they want their children to be vaccinated. You know, how necessary it is and the safety of it. They have their concerns, it looks like to me.
That's all on COVID. I have just a few more things.
Ms. Haggard.
Thank you, Mr. Chairman. Just a note to the last comment, I do know that a lot of parents have called pharmacies and aren't interested in a clinic, are personally taking their kids out to pharmacies to have the shot, which may not be factored into that survey. Ruth, I suggested to someone that I buy maybe 10 30 packs and some coolers and go up and outside Mac Mall, you know, and if you go in and you get a shot, you can have one of these beers. And the person I suggested that to thought it was a really bad idea. So that being said, a lot of states are incentivizing this. We've talked a little bit about it. Do you have any other information about the legality and the ability to incentivize? Because I do believe it's working to encourage people to get the shot.
We have been seeing some other counties, even in New York State, providing either a drink token for a shot or for a vaccination, or a percentage off is another consideration being talked about. But also the challenges that come just as you describe. I have not seen the legality or that it is not legal. We can certainly check into that. I would be interested in the board's feedback on something of that nature. You know, there was a conversation about having one of the local convenience stores provide an ice cream for a vaccination, or, you know, there's some of these kinds of things that we're seeing go on around the state that are incentivizing. They are working. You know, we've stepped down from the mass pod vaccination site environment. We've stepped down to the fire department, which has been tremendous in terms of word of mouth, information getting out and people turning up. I know we've run out of vaccine and had our sheriff's office send more vaccine out. So in some areas that way has been another level of success. But as far as I knew this morning, with our Johnson & Johnson clinic scheduled for the Messina Mall, we didn't have anyone signed up yet. And that's this week. So there's some concern about how we get folks to consider, to think about, to make possible getting the vaccination. So I'd be interested, certainly, Margaret, in feedback on that.
Thank you very much.
Mr. Smothers?
Is there any consideration in having the vaccines available for doctors to administer in their offices as part of a patient's office call to them? And that would certainly make it more accessible.
That is a Jolene question, but I'm happy to ask and find out. I think there was some pretty strict guidance around who is a provider. And if you recall, Governor Rescue Squad was wonderful. They got certified as a provider to be able to do the homebound. But I think most of the focus, that my understanding is that the doctors were being informed and educated on those one-on-one conversations to encourage folks to get the vaccination.
Mr. Akers?
So I can answer that. In the last public health meeting that we had, the doctors that are involved in the committee were expressing they wish that they had the opportunities. The problem is many of them don't have the super cold that they can keep the Pfizer. They can do the Moderna, but the problem is Moderna has gone from a 10 dose to a 15 dose. the doctors expressed the fact that over 80% of the patients that they're seeing on a daily basis have already had the shot. So the likelihood that they could go through a 15-dose bottle in a day is highly improbable. And they thought that they would be throwing a lot of the vaccine out. But that's something that we addressed at their last meeting.
And if I could, part of this survey also identified for folks to choose if they would prefer a pharmacy or if they would prefer a school clinic. And out of not even all of those that responded, 220 indicated the interest in a pharmacy and 775 indicated a school clinic was their preference. But I think even just my own anecdotal knowledge of folks going into the pharmacies to get vaccinations, even over the weekend, for their adolescents. So that may be pulling from that number as well. Anything else on COVID? Okay. The trails opened this weekend. The Ohv Atv Trails opened this weekend, and we issued a press release identifying that passes are not needed until June 1st. So we will also announce when we have passes available to purchase. Our expectation is that will be very soon. We're working through sort of a beta test on the software so folks can go on and order their passes. We're working to establish the opportunity for county departments, but also county departments are closed on the evenings and weekends to make sure that there is access to getting passes at any and all times that folks would be interested. So stay tuned for that, but we're hearing there were folks out on the trail enjoying it this weekend for certain. Wanted to mention that the plaques that were requested for the dispatchers that were honored recently have come in, and they will be distributed very soon. Also tomorrow, the Healthcare Committee will meet to review the 2020 annual review, and we'll provide you with an update on that at Finance next week. And then next week also, before the Finance Committee at 4 o'clock, we rescheduled the Buildings and Grounds Committee so that we could attend to some trail matters before the Operations Committee. So 4 o'clock on the 24th. We'd like to get together with that group to discuss projects focusing on the public safety complex, as well as some of the policies and the efforts that are being put forward to repurpose the old jail. The Audit and Stability Committee, Fiscal Stability Committee, will meet on the 26th, which is Wednesday, a week from Wednesday at 4, to do the entrance interview for the 2020 audit with Drescher and Malecki. And hopefully we'll be able to go over at Finance and then at that meeting as well, the unaudited results for 2020 to know where we stand a little bit better. Last week, there was a request by Legislator Forsyth for county-owned parcels. You should have in your email a map with the totals, but I can tell you that the county owns 3,895.6 acres. There's a map that identifies where those are and what kinds they are. And then I sent you a short list provided to us by planning with the main topics, agricultural, commercial, those types of things. And then I also attached a detailed list that planning sent to us with some more specific information for you to take a look at. So that's been provided as well. And I just wanted to mention quickly that we're excited with the support for social services in your consideration of the lease tonight. To see that placement in the community is a real change. And we're looking forward to the opportunity to keep you informed about what it looks like, how that progresses. It's not something that we've done before, but with as many as 17 new staff coming in, keep in mind we had a space problem in the Harold B. Smith building prior to the increase in those numbers. So in looking at being able to take some of our more experienced staff in Child Protective Services and in Prevent and moving those folks into the community, that makes a little bit more room for new staff coming in to be properly trained and to gain the experience they need to carry a caseload for us in the county. And then I believe that was it. I will get you information on the reimbursement for retirees and the turnover rate for vacancies this year. Is there any questions?
Mr. Akers.
So Ruth, on these plaques that we're giving to our dispatch, that monies will be coming out of our legislators' contributions.
That's correct.
Okay. The other thing I thought was, it's almost on your last issue, you were talking about the space there in Ogdensburg. Isn't the math wrong? It's 2,000 square feet at $12 a foot. Isn't that 24 grand a year?
I'd have to look at what you're referring to.
Like 11 or 12,000.
Can you look at that?
Versus the budget.
I think it's more than 2,000.
Are you looking versus the budget model?
Considerably more.
This will begin July 1st. Is that maybe what you're thinking?
Okay, so the 6 months.
Oh, yeah,
Okay, all right.
yeah.
Okay. Well, I thought the date on it was from June to July of 2022.
Well, the term of the lease, but the budget mod's only for this budget year.
So the monies are for the 6 months.
Yes,
Okay.
and we'll put it in the budget for your consideration for 2022.
Okay. All right, thank you.
Okay?
Anyone else? Mr. Burke?
Ruth, as we look at space issues, are we going to be talking more about the possibility of people working from home, at least in some cases?
That would be my hope, John.
Okay. And when might we do that, Ruth?
We continue to work through a couple of the issues related to our conversations in bringing back the staff that are back now. So my hope is as soon as we possibly can, we'll bring that to your attention.
Thank you.
You bet.
Anyone else? I have a question. How much of that acreage is inside the blue line?
Oh, goodness. That's not a category we have, but I'll get it for you.
Okay. There's no, but I'd be very interested to see.
Okay. We can get that.
Thank you.
Yep.
Mr. Burke?
In regards to the acreage, does the board still have an interest in exploring solar? Because if they do, NYPA has some services that they're now offering and would be willing to meet with us if there is an interest in that.
Well, let's have a show of hands if anybody's interested in that. Can I see a show of hands? 1, 2, 3, 4, 5, 6, 7, 8, 9. I think that there's enough interest that by this committee to look at it, look into it.
Okay. Outside of the scope of just the landfills, correct?
Absolutely.
Okay.
Well, John, you're talking about all of the acreage that we own. I mean, obviously, all of it isn't going to be optimal for a solar farm, but at least the properties that are.
Well, and all they would do, NYPA would basically talk about the different possibilities the county would have and provide some guidance. And if there was a decision to go with solar at any of the sites, provide some guidance on how to go about it.
Okay.
Okay.
We'll see to that.
Yes.
Thank you. Thank you, John. Anyone else? You're all set now, correct?
I am, sir.
Okay. Moving along to committee reports, the Board of Health, Mr. Akers.
So the Board of Health meets tomorrow night. We'll probably have a little bit of discussion about COVID and proper disposal of these masks.
Thank you, Mr. Akers. The CDP Board of Directors, Mr. Sheridan.
Thank you, Mr. Chairman. The Community Development Program Board of Directors Audit and Finance Committee met on Monday, April 19th. They reported that Head Start is running within budget. The COLA grant proposal has been submitted. As training and conferences become available, the TNT budget will eventually be fully expended. They will be receiving new COVID funds in the near future. They have been notified that the current COVID grant will not carry over, so they will ask for an extension and propose the purchase of a bus with $60,000 remaining. They have billed CACFP for January, but have expended through March. The weatherization has fully expended the 2020-21 grant and purchased a new cube van to add to their fleet. The health and safety budget's been fully expended. Heat has a profit of $2,800. The HCVP is currently doing well with a profit of $14,000. When a new housing rep is hired, the department will be fully staffed again. Security deposit funds really haven't changed a great deal. This grant has been extended to the end of June, as well as the CARES grant. There are no concerns of the funds being fully expended, and they have spent $20,000 on PPE to be distributed out to participants, and we will be installing a front door on the FOB entry and intercom unit. CSBG funds have been received for the 20% draw in the advance. And once they are 45% expended, their reports have submitted, they can request another draw. The CARES grant has been 25% expended. Township funds have all been received and are 23% expended. The food bank and CARES funding are helping to relieve the township funds. The CDP HP funds are slowly being spent. The food bank payroll grants have been fully expended. The neighborhood center directors are preparing to submit this year's grants. As far as their cash status, as of March 30th, is $646,803.42. Neighborhood center savings account has doubled or tripled from last year, while Governor North Country checking account has increased. The Community Action Angels account has gone from $3,933 to $33,000 in 1 year. And they also said something about their computer service contract with Clear Data Solutions is being renewed. This year's contract is different because it includes all IT services, remote services, and their monthly cloud care. And that's the report for community development.
Community Services Board, Rita Curran.
There's a question from Dave Forsythe.
I'm sorry. Who's the question from?
Forsythe.
Mr. Forsythe.
Yeah, my question's for Mr. Sheridan on the CDP. Do you have a total that they expend in an annual basis on weatherization? Any idea of that? And I don't need it tonight if you don't.
I think I've had that number in the past and reported on it, but I can't recall it right tonight. But I'll find out that information for you.
Okay, the reason I ask is a constituent in my district had called inquiring about weatherization. He gets HEAP, disabled, wondered about the weatherization program. I put in a call. I didn't have a lot of luck getting through to the weatherization program, but I did get a girl, my 4th try, who explained that the waiting list is 3 to 4 to 5 years out. You put the individual's name down. I never saw where it was put down. It just seems a little laxical to me from my first experience dealing with it. So I'd just be curious what they expend, how many projects they do in a year. I'd like to know a little bit more about weatherization, I think.
I'll get that information for you. We will do that.
I'd appreciate it.
Thank you. Ms. Curran?
So the CSB board met on May 5th. 4 presentations were given. One was about the North Country Freedom Homes merging with St. Joe's Family of Services. One was regarding Citizens Advocate and the fact that their zoning approved for the behavioral health urgent care in Ogdensburg, and they will be closing on the building on Park Street. A local citizen, David Whitesock, presented information about his business, Commonly Well, and that developed an addiction recovery and wellness assessment tool. And lastly, the Children's Home of Jefferson County presented on their plan to apply to the Office of Mental Health Legal Services for an 8-bed licensed children's respite home. And then there was a presentation and discussion about the update on the opioid treatment center, but you got that separately this evening.
Any questions? Seeing none, thank you, Rita. Mr. Denisha for the Office of the Aging Advisory Board.
Mr. Chairman, I have nothing to report from the last update, but our next meeting is Monday, June 14th at 10 a.m.
Thank you. And Ms. Haggard for the Youth Advisory Board.
Yes, thank you very much. I have a very nice thing here from Miss Terminelli. 90 people participated in the trash day with 60 youth. Thank you to the legislators who were there. You know who you are. On Wednesday, May 12th at 7 p.m., we offered a youth-only virtual meeting as an opportunity for teens grades 6 through 12 to open dialogue about how they're doing. Amy Richardson with Community Services helped with it. This meeting was facilitated by 4 of our youth committee teens. May is, as we know, Mental Health Month. Next, we released our needs assessment survey today and are asking surveys to be completed by May 21st. The survey is open to teens, grades 6 through 12, educators, parents, and community leaders. We also released our May newsletter, which can be found on our Facebook page. Lastly, May is Getting Caught Reading Month, and we welcome pictures and videos of people getting caught reading. It sounds fun. Please email them to the Youth Bureau and we will post them on our social media. That's it.
Thank you. Moving on to old or new business. Is there any old business? Mr. Smithers.
Yeah, I heard Legislator Forsythe last week express concern about the levels of the river. And we're talking about having these fishing tournaments come in and expecting that they're going to be satisfied as they have been in the past. And from thinking about that, talking to people that have been on the river, they're quite concerned, as Legislator Forsythe, about the water levels. And is this going to be a problem for these fisher people coming in? And so their comment was the floodgates are still wide open at the dam. And looking at the website that Legislator Akers forwarded to us, it looks like they might not be wide open, but they're certainly transmitting a lot through there. So I don't want to tell them how to do their job, but I think it might be a good idea if we just let them know if we're concerned about it. And if they could maybe do something to address that concern about the low river levels.
Any suggestions?
We've expressed concerns to other groups.
I don't know what we could ask the Power Authority or anybody else to do to raise the river. It's my understanding that they've cut the flow. Maybe Mr. Arquette knows a little more about the flow at the dam. Tony, shed some light on that?
Right now, I mean, to a degree, it's based on, I don't want to say that the Power Authority is in any way responsible for the levels of water. I believe it's the IJC and their plan that really are dictating the levels of water height. I think ever since 2014, when the plan 2014 came into effect in 15, you know, we've experienced a number of years of irregular water flow continually. Yet, you know, I think that folks playing the game at a much higher level than anybody in this room have went back and forth over why that is, including our governor. So I you know, I certainly can't speak for the Power Authority. Not at liberty to speak for the Power Authority, but I think the IJC would be the entity we would want to lobby if we have water concerns, water height concerns. Thanks.
Update us on what's going on with river levels.
Yes, and as soon as I have a response, I'll let you know.
Okay. So there's nothing, Mr. Smithers, that at least that I can see. I do agree that the river levels are low, probably as low as I've ever seen them. But as far as offering some solution as to what can be done, I don't have any. I would assume that the Power Authority responds to the IG or the IJC with regard to the cubic footage of water that they're passing up there. And he's right, they don't have any control over that. It is regulated by that by-country consortium there that, does the regulating. So we will get somebody in here and from the IJC to give us an update on it.
Mr. Chairman, I think the last time we met, we talked about a gentleman by the name of Tony David, who was really directly involved and knows an awful lot about the IJC.
That's who we'd be asking.
And yeah, it'd be nice to get a hold of him. And my big question is, I'd just like to know why the water levels haven't gone up, and they just have not gone up. It's been 3 or 4 weeks, and there's a lot of concern. And I took a little boat ride on the river last night down toward Morristown, and I think I only counted one boat that was out in front of one of the cottages, and it wasn't a big boat; it was a very small one. So yeah, there's a lot of people that are going to be concerned here with Memorial Day weekend coming up and so forth, and they'd like to know, what that chart looks like. And Kevin, your information you sent out a little while ago on those charts showed that there really wasn't much change in terms of the depth and the amount of water that's going out. And if that's the case, I'd just like to know why. And everyone that I know that is involved with the river, they want to know why it is. There ought to be a pretty quick, easy answer. Is it because of the water levels, which I doubt is the case, or is it because they're not allowing enough water out? Well, what is the deal? So,
go ahead, Sherry.
So I have it in front of me, and it's really interesting. You can follow it. So to answer Mr. Smith's questions, the bass people will not be, as long as they can get their boats in the water, they won't be affected. They'll find the fish, and they'll find the right depth to fish to access. The problem is for those of us along the river that have homes with stationary docks, getting your boats out. And if you have access to the report, we're down about a foot from what the average is at this time of the year. The weekly flow was 8,000, is what they let out, 8,020 cubic meters per second, where the average is 7,630, which means they are letting more out than what the average is. But the total weekly supply was 9,000 coming in with all the rain that we had coming in. So the average at this time of the year was 8,540. I think if you look down through there, what you'll see the big differences is the Ottawa River at the Carillon weekly mean flow. And so typically in the spring, the Ottawa River floods out Montreal. And so a lot of the times we have to adjust the flow coming out of our river in Messina so that the harbor, the people don't get flooded out in the city. Well, the Ottawa River is almost 2,000 less cubic meters per second going through there. So they obviously are experiencing a drought in Canada. So I expect that we are letting out more water to keep the Montreal Harbor, which is typically 7.3 meters or 24 feet. And really right now the harbor is at 20.5 feet. So my expectation is because of the lack of flow from coming out of the Ottawa River, that the more water is being let through the dam in Messina to compensate for the loss of precipitation coming out of Canada. And so this is a tricky thing. You have to balance the landowners on the Canadian side, the US side, the people that own property along the lake in Ontario, plus all the river, all the lakes that are emptying into that. So it's a complicated thing, and like Tony says, it's a lot higher up the pay grade than what we are. And I think Mr. David is actually on the IJC, is he not?
Correct.
So I think he can do the same thing. That's what I surmise, that the Ottawa River is 2,000 cubic meters per second is down a lot. And that I think if we shut off the river to raise it up so Dave Forsyth can get his boat in without scratching it, that the ships are gonna be hung up at the Montreal Harbor, I think, so. That's where I'm at.
Thanks, David. Any other comments? Ms. Haggard, and then Mr. Arquette.
Oh, I'm sorry. Are we on old business or the water level?
Well, what did you want to do? Did you want to talk about water levels or new old business?
I would defer to the water level people, and then I'd like to talk about new old business.
Mr. Arquette.
Thank you, Mr. Chairman. You know, I think a couple of the folks that spoke earlier touched upon it, but with full respect to the land and property owners along the river, because I do have full respect for the detriment the low water levels cause. But I've been a recreational boater for over 30 years on this river, and much like the positives we're experiencing with the motorized recreation on our trails, the boaters spend a lot of money at our stores getting ready for a day out on the river. So with the water low, again, the detriment to the landowners, but a detriment to our budget because of the sales tax revenue that's generated from the masses of recreational boaters out there, all the way up that shoreline, which encompasses St. Lawrence County and well beyond on both sides, obviously. But there's a lot of money that's potentially going to be lost through sales tax if something doesn't happen with the water levels. Thanks.
Thank you. Anyone else wants to talk about water levels?
Forsyth.
Yeah. Mr. Forsyth.
I'm going to lose you. I'm down to 5%, but with all bad comes some good. My wife and I did go swimming yesterday. The water's 47 degrees, so maybe it's warming up a little quicker than normal. Usually we wait till Memorial Day, so 2 weeks early. So maybe it's a good thing. Yeah.
I think you're off your medication, Dave.
Tougher than I am.
That's when I wait for the 4th of July.
Is there any chance Mr. Forsyth went in after dark for that? I'm not sure.
I'd like to see pictures.
No, and I did not fall off the dock, Tony. Yeah.
Ms. Hager.
Thank you, Mr. Chairman. Last week, we had a presentation about this fishing tournament thing in Messina. And I contacted the chamber because I know that they could be helpful to Mr. Messner and the other people that are organizing this. And I was told, and this is such good news, that there's a lot of grant money available for this through Market New York grants. And I know that they're asking the board for some of the people's money, but I thought we might also want to be aware that there's a significant amount of money available to them through the chamber, directed through the chamber by the Market New York grants. And I would certainly be happy to get the person that spoke to us in touch with Ms. Rouse at the chamber in order for them to facilitate that. Thank you.
Thank you. Mr. Burke and then Mr. Arquette.
Well, under new old business, I wanted to ask about the outpost in Potsdam, the highway outpost. And are we still in negotiations with Potsdam?
Why don't I turn this over to the chairman of the highway committee, Mr. Smithers. We met this afternoon. and that was a topic of discussion. Is that all right with you, John?
That's good, sure.
Yeah, go ahead.
Yeah, we did talk about it, and it's, Mr. Chambers thought that it would be appropriate to discuss it in executive session. And so we will be providing you with an update there, if that's okay.
It's fine. If I could, I'd just like to say that you know, I had the opportunity to speak with one of the town board members, and you know, their perception was that the negotiations were sprung on them with just a few days' notice, and I guess the reason I bring it up is I'd like to make sure that an entity where we have used their space for 30 years, that we give them due diligence as far as negotiations are concerned. And again, I'm not saying we haven't or we won't. I'd just like to say that I think we should. Thank you.
Mr. Ocfs.
Thank you, Mr. Chairman. I'd just like to dovetail briefly off what Ruth said about opening weekend here, and then start out by thanking all of you for supporting the local law with reestablishment of the trail system, and all the staff for all the hard work that they've done to get prepared for the trail passes. I could have sold hundreds of trail passes this weekend. You know, at the onset of this, just the thought, and I think that we know when we talk about the potential of ever increasing taxes, that we don't want to do it. All of our citizens are burdened, you know, to the end as far as their budgets. And so at the onset, hearing that there might be an additional money to be paid to go out riding was met poorly until it's been explained properly. And I was met with a lot of positivity. I traveled over 82 miles on the trails Saturday. I was traveling with probably around 30 machines and 60 people. We hit at least 10 to 12 businesses. And the only complaints that I heard all day long, and it was in a lighthearted fashion, was that people had to wait to get fuel at the gas stations, that people had to wait to get food at the restaurants, which again, it was in a lighthearted fashion, only to say that these businesses that are really our main goal in supporting, along with providing great trails for our citizens, is really, you know, going to be a successful venture. It has been, it'll continue to be, and this was a really big move here Saturday. And I explained that to all of the riders that were with me first thing in the morning before we left, explained to them why, you know, and how this is all working. And so they in turn were doing that every stop that we made. You know, and I think, again, with the education of how this local law is working to the benefit of all of our riders, along with, you know, creating a self-sufficient trail system, is being met very positively and by the masses. So thank you all again. And I think that we're all going to be very happy that we've made and come to this decision to move forward. Thank you.
Thank you. Mr. Perkins.
Thank you. Just kind of following what Tony and Margaret said with the trails. When Don Meisner came last week and talked about the fishing, he asked what we could do to get them involved with our public and our area up here. Wouldn't it be great if the chamber or somebody could sponsor some sort of trail rides for them to show them what our trails are? If they got up here, that might be a new sport that they'd come up and do on quite a regular basis. But just a thought.
Good idea.
Okay. Any other old business? Any new business? Mr. Denisha?
I'll keep it brief.
No. Okay.
This afternoon, I attended a Cannabis Webinar that was sponsored by NISAC. It was remote. And just some highlights from the
Highlights?
They
You got the terminology down.
they anticipate $350 million of tax revenue annually. They They also, looking at, one of the numbers that was thrown out in regards to potential jobs was 30 to 60,000 potential jobs. I'm assuming that's in the marketing and the growth and distribution. But they did note that cities, towns, and villages may opt out of allowing adult use dispensaries or on-site consumption licenses by passing a local law by December 31, 2021. They did note that they cannot opt out of adult use legislation because it is a state law. So cannabis possession and use by adults 21 or older is legal. However, the other thing that was noted was the Indoor Clean Air Act. It applies. So anywhere that tobacco, smoke, cigarettes, cigars, pipes is prohibited, that applies to cannabis as well. But the thing that I wanted to ask the sheriff if he'd been here tonight, and they did mention drug recognition experts or DREs.
Yep.
And do we have some deputies that have actually meet the qualifications for DREs?
We do, and we are also getting some additional training. I also believe the new K-9 that is with the sheriff's office is not focused as much on marijuana as more trained specifically in other drugs, so that not to confuse with legal marijuana. Yep, they're right on top of it, sending people to training already.
Okay, great, thank you.
Those Mother's Day was last week. Those were the experts, Larry.
Yes. If you've been drinking.
Any other new business? Seeing none, we have need for executive session for litigation and personnel.
One moment. We have reason for litigation, personnel regarding the medical, financial, credit, or employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation, and for the proposed acquisition, sale, or lease of real property, or the proposed acquisition of securities, or the sale or exchange of securities held by such public body, but only when publicity would substantially affect the value thereof.
Thank you.
And appointments.
Entertain a motion to move into executive session.
Mr. Chairman, before we do, if I can follow up with this, Mr. Denisha. Before last year, before COVID, it was the counties were going to have to make that decision whether marijuana would be sold. You're saying now it'll be towns and villages?
According to the today's webinar, it's counties have been taken out of the mix, and it's directed to the towns, village, to the municipalities.
Okay, and that's the way it is in Massachusetts.
Sure.
Okay.
Mr. Smith.
Just want to make sure your description for executive session included the ongoing negotiations.
It does.
I thought, but I wanted to make sure.
Okay.
I move to go into executive.
Mr. Fay did, you second it? Okay, all in favor?
Aye.
And if there's no objection, I believe Mr. Chambers was going to be included. We are back online, Mr. Chair.
Okay, we're in open session again. Is there any further business to come before this committee?
Mr. Chair, I just wanted to share that Assemblyman Smullen contacted our office and will be in Canton on Friday, and would extend an invitation for any legislators who'd like to meet with him. He'll be present. I'm not sure of the time, so we'll communicate that to you. That's all I have.
And when is that now?
On Friday, May 20th. 21st, I apologize.
You'll be there, won't you, Tony? If there's no further business, we're adjourned. Good night, all.
Would someone just let Mr. Fay know the Canton Bears won 15-0 tonight in Plattsburgh?
Thank you.
Hey.